I remember during my very first rotation out at Phoenixville Hospital when I was a third-year med student, I delivered a baby within my very first couple days there that was to a couple that had, I think, 4 prior daughters, and this was going to be their last baby, and delivered the baby, and it was a boy. And they were so overjoyed because they really wanted to have at least one boy just to kind of balance out the family a little bit. And I remember delivering the baby, kind of telling the parents it was a boy. They didn't know in advance. The dad picked me up like off the ground, and the family was so happy. So that was one of my very first deliveries, and definitely the one I remember the most. I'm Leo Pereira. I'm a maternal fetal medicine doctor at OHSU. When you're trying to develop a care plan for high-risk patient, there are a number of very important considerations. One of those is, what does the patient need medically? And that is the primary driver of our recommendations. However, there are a number of different ways to arrive at that plan or to arrive at the outcome that's desired. And so within that context of doing what's appropriate medically, there is a spectrum of care that we can provide, and that is frequently driven by what's most important to the patient. For instance, if the patient really has a lot of anxiety around the pregnancy itself and feels like they would benefit from seeing the baby or hearing heartbeat every week, even if that's not 100% medically necessary in order to provide care, it might be necessary to provide compassionate care or to provide the patient with what they feel they would benefit from. And we try to make the experience for patients with high-risk pregnancy as reassuring as possible.